wish I could remove this sign so that you can see a little bit more of me. I think I need a box. So thank you to all our staff and, sorry, I'm on the wrong page. Health Consumers Queensland is blessed to have a team of staff who have experience in effective consumer engagement, either as consumers or health service staff themselves, or in fact both. And they have passion. We wanted to provide this opportunity for each of our staff members to reflect on the significant changes, highlights and challenges that they've observed or influenced in consumer and community engagement over the past 2 years, since we became a funded independent organisation, although we have existed in various forms since 2008. Each of our staff members will then introduce a consumer, carer or health staff member who will share their observations on the barriers and service improvements that staff and consumers have experienced on their journey of embedding effective partnerships. My role as CEO is to ensure that our hard-working team of 8 staff covering the whole state have the support, resources and expertise to implement the mission, vision and strategic direction of our organisation. This includes each of us being living examples of the values of our organisation: leadership, having a positive impact, fairness, innovation, partnership, and perhaps most importantly, zing and zest. We also have a responsibility to ensure that we're maximising the impact of the significant financial investment that this state government has made in our organisation, so that the Queensland health system can receive the most profound benefits of meaningful consumer and community engagement. As such, Griffith University is undertaking an external evaluation of the impact of our services with their initial report due in November. We hope that this will confirm what we hear anecdotally about the positive impact of our work, but we will also embrace any learnings about how we can continue to improve the support, strategic advice and training that we provide. And there is a session at the end of today's concurrent sessions with some of the initial work done by Griffith University. I encourage you to attend that. Sometimes I'm in the privileged position of supporting projects which are working to transform not only services themselves, but the long-term relationships between stakeholders. 2 current examples are the Barrett Commission of Inquiry Implementation Project, which you've just heard about, and the Logan Together Community Maternity and Child Health Hubs. Both involve staff and consumers being willing to trust, listen, co-design and realise a shared vision for a more person-centred delivery of healthcare. But I know from the current experiences that we hear, and there are too many, from both staff and consumers, that there is still much work to do to make sure that every Queensland health consumer is guaranteed kind, compassionate, consumer-centred care. This will take a long-term culture shift and communication training with a focus on customer service and empathy. Many of the projects and issues that I support are triggered by a poor experience of care, either an issue of error or quite often poor communication. We need more consistency from health services around responsiveness, transparency, and an ability to demonstrate that the system has learnt from these mistakes. I provide our organisational expertise on a number of high-level committees in areas including maternity, occupational violence, medicinal cannabis, NGO quality assurance and more. I regularly, along with our chair, Mark Tucker-Evans, and other staff members, provide strategic advice on the issues concerning consumers and how to engage consumers to share and seek information in order to improve the health system, to divisions of the department, the Minister's Office, parliamentary hearings, the Australian Commission on Safety and Quality in Healthcare and more. And in the last 2 years, I've witnessed an increasing recognition of the importance of considering the needs of Queenslanders in policy, legislation, departmental and government responses to public health and safety and quality issues. I think this shift is based upon a desire for more transparency, accountability and informed decision-making, and an understanding that consumers have to receive services that aren't just clinically safe, but feel safe to us, and are also safe spiritually and culturally. The challenge is that despite this high level support and a rapid increase in the amount of consumer and community engagement activity in the system in Queensland, particularly since the introduction of the National Safety and Quality Health Service standards, the consistency of resourcing and the depth and effectiveness of engagement across the system is varied. Our organisation has a vital role to play to reduce this variability, and as such, I would like to introduce Anne Curtis, our project manager, to describe the increased desire for staff to seek our assistance to build their engagement skills so that they can partner effectively and meaningfully. Anne Curtis, our project manager.
Good morning, everyone. Just before I do, there's someone who I would like to introduce because she's always hiding. And she's such an integral part of our office, our very small staff, and she pays us. And this is Nicole, who's our office manager, just standing over at the door there. So I told her she wasn't allowed to leave the room until she was acknowledged. So you'll get to meet all our 3 project officers soon, and our project support person, Suzanne. I've been with Health Consumers Queensland now for 2 years, and started in 2015 when we got our funding of 2.6 million from Queensland Health, and that's when our staff all started working. So my reflections are that with the key drivers of the National Safety and Quality Health Service Standard 2, partnering with consumers, and the requirement for Queensland hospitals and health services to have consumer engagement strategies. Over the last 5 years, there's been a rapid increase in the amount of engagement that's been going on and activity within health services. So the support that we've seen in that time over those last 2 years has increased markedly. So we've been able to provide training. We provide strategic advice, and we provide recruitment of consumers. So where 2 years ago we might have just had a few requests for training, we now have a training calendar that's got 30 trainings, workshops and webinars planned for this year, or that we've already facilitated, and we have more coming online. So we're an incredibly busy little group of people. So the thing is, though, that as we go around, we're also seeing that consumers are given more and more opportunity to have a voice in the system, and even at a statewide level, which is fantastic. So, so for the first time this year, as an example of what this is like out there right now, we're providing the Graduate Certificate in Consumer and Community Engagement. Now, this is the only accredited course in Australia. And Queensland Health very kindly advertised this with my email address through their e-alert, and we put it out through our e-news. Now, I had a rainfall of emails come through one afternoon, and in an hour and a half, I had over 90 emails. They're still coming today, weeks later. Every day there's more. And it's such a reflection of the interest in this work across the state. A lot of these are coming from clinical staff. There might be HR staff. There's staff at all levels of the health services, of Queensland Health Department itself. And I've read every single email. There's over 300 of them. And what they say is, and I know that course is booked out, can I please come? Because I'm about to start doing this work in my service area. We're about to start engaging with consumers, or we're doing this work and we want to know how to do it better. And it's just fantastic to see that interest is really there at all levels. Very encouraging. Our requests for our strategic advice, it's just growing all the time. I mean, we're just full on. And also the recruitment of our consumers, which Jo will talk about in a moment. So ultimately, if I had one thing that I'd like to see happen in the health system going forward, because we identify in our trainings that there are barriers to embedding this work into health services. If we could break those barriers down, remove those barriers, where this work becomes just a part of everyday business for health services, then that is my one wish for the future. So now, just to share his reflections on the last 2 years, I'd like to introduce Stephen Stewart, who is the manager of the Strategic Policy Unit at Queensland Health.
Good morning, and thank you, Anne. So Anne asked, as per the program, about what's happened in the last 2 years about cultural change. In summary, one of the things that happens now is we start doing work, and I know this happens in other areas than just mine, and the question of how we engage in consumers is asked. I think it's fair to say that hasn't happened as much previously, and I think the examples like provided by Janine during the panel of, in years gone past, the Barrett Centre work wouldn't have happened in the way that it is now with actual meaningful engagement. Just like to reiterate the comments in terms of those large-scale projects, but it's also important to note at day-to-day work how much more consumer engagement is happening. A couple of the other departmental staff here provided examples of where that's happening. For example, in e-health, providing representatives for various committees implementing IT and system upgrades, and particularly in patient safety and quality, developing programs to support clinicians in delivering higher quality, safer care, and also looking at patient safety incidents and how we can do better next time. Also raising awareness to the executive. We have the Health Consumers Collaborative, so that's made up of representatives of consumers and executive of the department. Sharing those experiences of the difficulties to engage with that level so that they can direct work down through the department to better engage consumers. Often we're one step removed in the department. We work to support frontline staff to deliver better services, but the engagement of Health Consumers Queensland has really helped to reduce that barrier. I think we're getting better at it. We still have a lot to do, of course. The training anecdote that Anne gave was a perfect example of that. And for all the departmental staff here, we encourage you to attend that. Looking forward, we're looking forward to further work with Health Consumers Queensland and consumers themselves to embed that in our work going forward. Ideally, as per what Anne said, we'd like that just to be the standard rather than something that we're looking to do better. Thank you.
Thanks, Stephen. Jo Smethurst is right up the very back there, and Jo is one of our project officers, so over to Jo.
Hi everyone. So I'm a project officer and I work 3 days a week, and I'm incredibly busy working 3 days a week to support the consumers in our statewide network to build their capacity and confidence to do this really meaningful work of consumer partnerships. I work very closely with Suzanne Werges. Suzanne every week is sending out emails. I think probably twice a week you may get emails from us with opportunities for consumers to be involved in things, whether it's speakers at a conference or free conference registrations or attending full-day forums or speaking for 20 minutes at something or sitting on a statewide working group that's going to be meeting for the next 3 years. And when I started 2 years ago, we would send those emails to our network in an ad hoc basis when we received these requests. And now we are literally managing, it's like, right, no, we're going to only send 2 a week. And the Tuesday is for new things, Friday is for reminders and absolute urgent requests. So just know that we are being mindful of us filling your emails. But I also want to thank each and every one of you who have submitted expressions of interest for those. Every single time we have a consumer request, we get lots of great people putting their hands up. It takes courage, it takes heart, it takes a great degree of emotional intelligence to put yourself out there and sit as an outsider on a group, often on your own, speaking up and looking after the interests of consumers. So all of you who do that, I'll get teary. I'll thank you from the bottom of my heart, because you do make a difference, and what you do is valuable and meaningful. Tash is saying, don't cry. Thanks, Tash. See, and consumers support each other. Keep supporting each other, keep mentoring each other, keep buddying up, and keep rubbing shoulders and backs and giving each other a bit of a congratulations, you're doing a great job. Because sometimes it is challenging, and sometimes we just need a little bit of love and comfort to keep on going. That actually wasn't what I was going to say. I've actually got notes and I haven't actually said what I was going to say. But that's okay. The other thing I wanted to say as well is the reason that those requests are growing is because of the visibility of consumers, because intelligent, awesome people keep putting themselves out there, keep speaking up at plenary sessions like this, keep talking about love and compassion and talking about the needs of consumers and carers, and people see that and go, oh, I want so-and-so at my forum. And so they contact us and they will actually request, can I please have so-and-so? And we say, we've got a whole pool of people who are awesome. Let's do an open and fair, transparent process so that everyone gets a go at this. So thank you for being those ambassadors for change, because your visibility, your intelligence, your courage is creating opportunities for more people just like you to get up and do this as well. So thank you. That was more than 1 minute. I would love to ask Liz Miller, who is part of our statewide consumer network, who does an awful lot of work with Metro South, partnering with them on lots of committees, so much so that she doesn't sometimes admit to her son what she's done on that day in case she gets in trouble. I'm going to hold the microphone for her.
Yes, hi, my name's Liz Miller, and I'd like to share a recent wonderful experience that I've had of consumer advisor work when I was invited to take part in a business planning session with one of the hospital facility departments. And this was the very first time that they'd invited an outsider into their inner sanctum. But they said that they really wanted to hear the voice of the consumer, so that it was more than just a tokenistic, effort of ticking the box to say, yes, we've had a consumer engaged with us. Of course, I was delighted to get an invitation like that. But my first question to them was, well, what do you expect of me? How am I going to be able to contribute really well, and what can I do to prepare beforehand? Maybe you can just hold this here so I can see my notes. Thanks, Jo. And so that actually led to an invitation for me to come and meet with them in the week beforehand with the team who were going to be facilitating that day, so that I could find out who was going to be there, what their roles were, and what part they wanted me to play and what process they were going to use during the day. And they really were so delightful, because they said, how can we accommodate your needs? And I said, well, you know everybody else in the room. You'll all know everyone else. But of course, I'll be the stranger who's walking in and doesn't know a single face. So they said, we can all wear badges. And, they gave me a list of who was there, what their role was. And so I felt a lot more confident, I suppose, about walking into that room and comfortable that, when I was speaking to somebody, I'd actually know their name. And I should add that they also gave me this huge stack of strategic plans and all of this information to take home and read. And I thought, I'm not going to get any sleep for the next few days. But I did then ask them, how I could best prepare. So they provided all of that for me as well. So the planning day came and went. And I'd have to say that it was actually an amazing experience of being involved with a group of people who really wanted to hear how could a consumer have some input into what they wanted their future to look like? And some of the questions I was able to ask was, at appropriate times, I'd say to them, well, you're talking about moving from the traditional medical model of providing care to being more patient and family-centric. How are you going to do that? what's that going to look like on a daily basis? And how are you going to know that you're achieving those outcomes? Or when you collect feedback and data about patient experience, how will you know if you're really gathering information about what's important to patients about the care that they're getting? And how will that be reflected in your analytics? Are you actually going to value the qualitative information as much as the quantitative? Because that's the traditional research method. You've got to do everything as a randomised controlled trial, and that's the way they've been taught. But I think there needs to be a shift towards really valuing and appreciating what the consumer voice has to contribute to healthcare in general. So as I reflected on that experience afterwards, I thought, you know, there are a few principles here that are really important in any constructive consumer engagement activity. And I think at the consumer level, for us, we need to find out what's expected of us and be as well prepared and informed beforehand as we can be. We should be reading widely, finding out what other people are doing in other parts of the world so that we've got some solutions, potential solutions to bring and not just issues and problems to the table. We need to also think globally in terms of the big picture, because sometimes we get bogged down in our particular experience and what that's meant for us or our family or, you know, friends that we've had. But I think we also need to remember that healthcare is provided by people who are genuinely caring, but who often work in a complex and difficult environment and a system that's often slow to change. Then at the organisational level, I think it's really nice to be welcomed into a meeting and to be introduced to people and to have them say, you know, introduce you as somebody who has got something important to say. And organisations can smooth the way, like this group did for me, by, you know, making sure that it's a mutually beneficial interaction. I think they also can help us to come prepared by providing information beforehand, making sure that we're included in emails that are distributed to the rest of the team, but, you know, so you don't get there and find out that everyone else has some information that you weren't given prior to the meeting, because that makes you feel a little bit left out. And I think that, you know, we need to also remember that the ultimate aim is to envision and find collaborative solutions for a safer and better way of delivering healthcare to every patient every single time. I think that's what everybody should be working to together. So just to round off my minute, that's probably 2 minutes now, I just want to finish off with some wise and encouraging words from an amazing Canadian consumer volunteer who says, "Participation and activism in healthcare is truly an act of citizenship. Every door can open, you just need to open it a little and let the patient voice in. If you give it a try and respectfully learn all you can and look for opportunities, you are able to have an influence." Thank you.
Thank you so much, Liz. And I have to say, I didn't give Liz much warning that I was going to call on her to have a chat with everyone. And thank you so much, Liz, your wisdom and everything. I think you've just written our guide for consumers. And now I'd like to introduce you to Reema Naresh. She's another project officer at Health Consumers Queensland. She's our newest member of staff, and we've thrown her in the deep end, giving her a microphone this morning.
Bula Vinaka and namaste, everybody. Yes, I am the most recent addition to this amazing, dynamic and very small team. I've greeted you in my language. I come from the island nation of Fiji and my heritage is Indian. And in my culture and my tradition, we spend a lot of time learning from our old stories and trying to understand where we come from, which allows us to understand where we need to be right now, which gives us perspective on where we need to go. And certainly in my first 3 weeks of being with Health Consumer Queensland, I heard a lot of stories from all the amazing consumers that I got to meet. And each consumer has an amazing story to tell, and for me, consumer engagement is all about hearing these stories and listening really well to them. Because I have been very short in this path, in this group, I'm going to reflect to you a story or my experience of consumer engagement in my previous role. So in my previous role, I worked as a multicultural health worker for Children's Health Queensland in an amazing program called the Good Start program. And in this program, consumer engagement happened in an amazing way. So the staff that we recruited, so as a multicultural health worker, I was recruited to work with Fiji Indian community. And in the same way, we had Samoan health workers, Tongan health workers, Papua New Guinean health workers, and all the communities represented. And what this meant was that we were able to connect really quickly with the group that we needed to work with. And this allowed us to have conversations with them, and certainly lots of stories were exchanged, and we were able to produce programs and resources that were really tailored to this group. And so I think that this kind of work is happening, and it's really wonderful to see it. And I'm really pleased to let you know that one of my colleagues from my Good Start team, Kirsten Kira, is going to be presenting today on one of these amazing programs on maternal health. So do check her program out. And maybe the other thing I want to just quickly share is a barrier that sometimes I often hear in the department, having worked in Queensland Health, is that culturally linguistic, diverse people don't connect with services. And I guess what I want to say about that is that if you get us on board and help us co-design things, we'll be there right with you. Just listen to our stories first. So I look forward to sharing my experience of working with culturally and linguistically diverse people and the land that I come from, and to share that with each one of you in whatever way possible to help you with your consumer engagement. And during the breaks, come and say hi and meet with me so I can get to know you better. And now it's my pleasure to introduce Jo Sharing, Person-Centred Care Lead for the Townsville Hospital and Health Services.
Thank you. So one of my roles in the Townsville Hospital and Health Service has been to establish the consumer engagement program across the health service over the last couple of years. With the exception of our mental health service, this has been quite new for most of our staff. When Rima asked me to think about what's been happening the last couple of years, a quote from a lady called Maya Angelou came to mind, and that quote was, "When you know better, you do better." And I think that sums up what it's been like for us in the last couple of years, is that it's been a journey. And it's been a journey that's required a lot of patience. And if you ask my husband, I'm not a very patient person. I'd like the change to happen tomorrow. And when you're working with big, complex health systems, that's not the way it works. And so I've had to be very patient. And the consumers who've come along on this journey with me have had to be very patient as well, as we take steps towards embedding consumer partnership into our organisation. One of the things I think has been really important, as someone who likes to see change happen quickly, I've had to learn that it's been really important, both from a staff perspective and from a consumer perspective, to ensure that those experiences of partnership are positive, to actually take it at a pace where we are ensuring the consumers feel safe and that the staff feel safe in that process. And so being able to pace it in a way where the organisation is actually ready to embrace consumer partnership, I think has been really important, and it's been an important lesson for me to actually learn. A couple of years ago, so in 2014, I had a conversation with some staff members, and I mentioned something about maybe we could have consumers on a recruitment panel. And at that point, there was a gasp in the room, like that was something they'd never heard of before. I wouldn't be hearing that today if I said that to some staff. So I think actually that's a long way in a couple of years, that the culture has shifted. Once people start seeing and working with consumers in their organisation, they really do embrace it. And sometimes the barriers just need a little bit of time and patience for people to be able to move forward.
Thank you, Jo. So I'd like to now introduce Chelsea Gugard to you, our other project officer.
Thanks, Rima. I'm going to make this short and sweet because I know everyone's hungry. So as Rima said, my name is Chelsea and I'm one of the project officers at Health Consumers Queensland. So on my reflection, we've continued to work with the primary health networks, or PHNs, and private hospitals from across the state, and they have continued to strengthen the way they partner with consumers and the community in ways that are real and authentic. It's great to see how many PHNs are creating innovative ways to engage with consumers. For example, Central Queensland, Wide Bay and Sunshine Coast PHN, who are presenting today, You'll hear how they have heard from consumers and carers about the ways they wanted to partner with them, rather than making the assumption about what was going to suit their consumers and carers. Others are also showing how comfortable they are of partnering with consumers by thinking about the ways in which to measure the effectiveness of the organisation's consumer engagement. And we've also provided both workshops and training to PHNs and private organisations across Queensland. Thank you.
Thanks, Chelsea. I won't take too long also. I want to echo the points that have already been made, and I will cover off on a lot of what has already been discussed. As a PHN, as Commissioners for Local Service Needs in Primary Care, we are really focusing on developing a framework that enables consumer and carer needs to be embedded and to be heard as everyday business. At Brisbane North, we aim to embed consumer and carer participation across our full commissioning spectrum, from assessment, planning, co-design, delivery and evaluation, so not just in the delivery but throughout the entire process. Some of the opportunities we're focusing on addressing are obviously increasing collaboration with our Metro North HHS, but more importantly, working collaboratively with the whole sector to develop transparent and effective models for true partnership to address the complex social health needs in our communities. Taking the lead from our excellent mental health and AOD sector work to promote and enhance consumer engagement across the primary health sector more broadly. We're extremely proud of the efforts of our consumers and carer reps in the mental health space, who have spent years advocating for advanced support opportunities to ensure that services which they access are designed to deliver to meet their needs in a way that suits them. I'd like to highlight the members of our network who are here with us today, but also all of the consumer and carer representatives in the room today, and ask them to take back to those networks that you work with. As an engagement professional, it is your work and your professionalism and your positive attitudes that you bring to the room that make it so easy for us to advocate to broaden engagement across the health sector. So congratulations to you all.
Beyond next year's forum and beyond the end of our 3-year contract in June of next year, we're hopeful that a continuation or maybe even an increase in our funding would ensure that consumers and the health system can continue to benefit from you working together to tackle the challenges of our health system. Additional investments on top of our current funding would provide greater ability for us to be able to support rural and remote communities in your own communities, increased ability for us to respond to ever-increasing requests and proactively targeting those health services who are most in need of support, and also being able to have more capacity to support health services to evaluate the impact and the benefits of their engagement activities. We look forward to continuing to support your work and reflecting on more of your achievements at next year's forum. If you're not already a member of our email network, please do join so that you can get those emails that Jo talked about and we can learn from what you're doing in your communities. Before we break for morning tea, I would like to take the opportunity to thank all of our incredible team, not just for sharing their learnings with us now, but also again in creating today's inspiring and successful event. This time for us with the added challenge of being in a regional city, which also is bringing so many benefits. All of the team have pitched in to informing the program and assisting last night and today. But our main thanks really go to Chelsea Grugard for building on the successes of last year, including to listening to all of your feedback. So I just wanted to take the opportunity now to thank Chelsea for all of your hard work in making today a success. And for all of your help for making it possible for all of the consumers to be who we provided you with travel and accommodation support, and for providing weeks of administrative and organisational support. We're really so grateful to have all three of you in our team. Is Suzanne here? Outside? Oh, I'll give her this later. So please, apologies that we're running a little bit late. We will attempt to stick to time and come back here in the 2 concurrent sessions at 10:30. Please join us for morning tea, networking and visiting the learning pods in the foyer, and we hope you enjoy the rest of the day. Thanks.